Hello and welcome to the lecture on Chapter 24, Sleep and Rest. The objectives are to delineate age-related changes that affect our sleep and rest patterns, identify psychosocial, environmental, and physiological risk factors, discuss sleep changes and problems that commonly occur in older adults, assess sleep in older adults with an emphasis on identifying opportunities for health promotion, and identify nursing interventions to promote optimal sleep in the older adult. Approximately 1/3 of a person's life is spent in sleep and rest activities. This is a time when our metabolic processes slow down and allow for tissue repair, growth, and cognitive and emotional processing. In the last 50 years, since the 1970s researchers have focused on how sleep affects our wellness. The quality of our sleep is what affects our wellness and affects overall health. Sleep patterns are described in terms of sleep stages, and these stages are classified as the presence or absence of rapid eye movement, or REM sleep. During non-REM, that's when our hormones are released, muscles relax, body systems slow, and essential restorative functions take place. REM sleep is characterized by flaccid muscles, increased gastric acid secretion, increased cerebral blood flow, fluctuating blood pressure and thermoregulation, and increased rate and regular rhythm of pulse and respirations. So some of these sleep patterns, like the ones that affect our cardiovascular and respiratory system, may actually exacerbate disease states. Circadian rhythms are known as a biological clock, and functions that revolve around circadian rhythms include sleep-wake cycles, thermal regulation, and hormonal secretions like cortisol and melatonin. As we age, the sleepy phase starts earlier, with earlier morning awakening. So normally the circadian rhythm of sleep-wake cycles are usually about 10 p.m. to midnight, and the wake cycle then starts about 6 to 8 in the morning. The circadian rhythm of sleep-wake cycles in older age are then exacerbated by lack of exposure to bright light. Anxiety and worry can lead to difficulty falling asleep, frequent arousals throughout the night, and difficulty returning to sleep. Lack of social stimulation or interesting activities can make it difficult to establish these sleeping patterns. Patients who are isolated may spend long amounts of time in bed. Also, older adults who spend most of their time in the same room, like those who reside in long-term care facilities, might have poor sleep patterns because it's hard to make the difference between where we are awake and sitting all day to where we're supposed to sleep in the bed at night. Noise is an environmental condition that significantly influences sleep patterns, especially for those patients in acute care settings. Nursing interventions in this workplace may be to utilize white noise, quiet voices, and promoting bright light exposure during the day. In clients in long-term care, other environmental changes that make quality sleep difficult are lack of privacy, insufficient exposure to bright light during the day, and uncomfortable temperatures that aren't like what the normal individual likes, like warm or cold. Usually residents of long-term care have to adjust to the organization schedule. Thus, these activities or having activities and sleep around the nurses and dietary aides' time schedules is not individualized and conducive to sleep. Pathologic conditions like arthritis pain, as well as sleeping disorders themselves, like obstructive sleep apnea, will disturb sleep. Check out the table 24.2 in your book, and it talks about a lot of other pathological conditions that can cause sleep disturbances. Certain medications can cause disturbances in sleep. Some common medications, as listed in table 24.3, include steroids, thyroid extracts, and cardiac meds. Other substances like caffeine, nicotine, and alcohol also impair the quality of our sleep. Let's look at this question. Is the following statement true or false? This is true. Older adults spend increasing amounts of time in bed, not always attempting to sleep, with a decreasing proportion of time in actual sleep. Older adults spend an additional 3 to 4 hours resting in order to attain the same amount of sleep attained by younger adults. However, sleep patterns of older adults are influenced by physiological, environmental, and psychological factors. After the age of 50, diminished sleep efficiency is attributed to both trouble falling asleep as well as an increase in nighttime awakenings. Let's look at this question, true or false? This is false. Normally, circadian rhythms allow adults to become sleepy between 10 p.m. and 12 a.m. and awaken rested between 6 and 8 a.m. In older adults, this rhythm leads to sleepiness earlier in the evening and to also awaken earlier in the morning. Last question, which disease condition is likely to be exacerbated during sleep? There's a lot of good choices here, but the biggest one is going to be A, coronary artery disease. Disease conditions that are likely to be exacerbated during sleep include cardiovascular disease, hypertension, duodenal ulcers, coronary artery disease, and COPD. During REM sleep, this is when the physiological changes occur, like flaccid muscles, increased gastric acid secretions, increased cerebral blood flow, fluctuating blood pressure and thermoregulation, and increased rate and irregular rhythms of pulse and respiration. Overall functional consequences of age-related changes in sleep are insufficient, inefficient, and poor quality of sleep. In addition, the presence of risk factors that interfere with sleep increases the prevalence of older adults with sleep disturbances. The most common complaints of older adults are daytime sleepiness, difficulty falling asleep, and frequent nighttime awakenings. Poor sleep is also associated with multiple cardiovascular diseases like stroke, metabolic syndrome, substance abuse, accidental injury, and mortality. Excessive sleepiness is the inability to maintain alertness due to hypersomnolence. This differs from fatigue in that fatigue manifests as difficulty in physical performance. Insomnia can be chronic or it can be transient, and it manifests as a poor sleep quality or difficulty falling asleep that causes daytime impairments. Obstructive sleep apnea. This is a really important sleep disorder. It's characterized by apnea, which is defined as an involuntary cessation of breathing for greater than 10 seconds, and that this apnea occurs more than 5 to 8 times per hour. Obstructive sleep apnea occurs due to the weakening of the soft palate and the muscles of the throat, which cause them to relax during sleep and block the passage of air. Due to this reason of the development of obstructive sleep apnea, it's not exclusive to old age, but the prevalence increases with age, such as in women when we go through menopause and our estrogen decreases, the soft palate also gets softer and we start snoring with older age. We can also see this with heavily obese patients where the muscles are weaker and then they lose their airway with sleep. Symptoms of obstructive sleep apnea include daytime fatigue, morning headaches, diminished mental acuity, and loud snoring punctuated by brief periods of silence. There is strong evidence that obstructive sleep apnea leads to increased risk of stroke, hypertension, diabetes, heart failure, AFib, depression, and other cognitive impairments. Thus, this makes it really important for healthcare professionals to identify signs and symptoms of obstructive sleep apnea and initiate a referral for evaluation in a sleep lab. The treatment of obstructive sleep apnea correlates to positive health benefits. Other sleep disorders are sleep-related movement disorders, which will disturb sleep patterns. Two of them are restless leg syndrome and periodic limb movements during sleep. Restless leg is a sensory motor condition characterized by an uncontrollable urge to move the legs during times of rest or inactivity, and this urge is relieved by movement. Additionally, these symptoms of RLS are not attributed to other diseases like leg cramps or hypokalemia. Restless leg syndrome should be treated with medications to promote sleep. However, in addition to the medications, we want to promote other non-pharmacological interventions like regular, adequate daily exercise, stress reduction techniques like progressive muscle relaxation, soaking in a warm bath prior to bedtime, and reducing irritants like alcohol, caffeine, and nicotine. Periodic limb movements during sleep is very similar to restless leg syndrome, except for these involuntary movements are more rhythmic and they usually last 20 to 40 seconds. The goals of the nursing assessment are to identify health-promoting behaviors and to identify conditions that interfere with sleep. Two easy to use and readily available tools that are valid and reliable include the Pittsburgh Sleep Quality Index, or the PSQI, and the Epworth Sleepiness Scale, or ESS. The PSQI assesses sleep quality and patterns over the last month, while the ESS assesses daytime sleepiness over the past week. Nursing interventions to promote sleep wellness for older adults focuses on health education and direct interventions like environmental modifications and comfort and relaxation strategies. These interventions need to be tailored to the client's needs. For example, in the community setting, the client and caregiver should be taught self-care interventions, while in long-term care, interventions are more focused on how our routines can improve sleep patterns of the residents. In the acute healthcare setting, identifying sleep apnea is the major goal due to the cardiovascular and respiratory risks. In the past, improving sleep quality focused on medications such as hypnotics. However, these medications have adverse effects and oftentimes outweigh the advantages of sleep. We want to remember that older adults are much more susceptible to commonly used drugs for sleep like benzodiazepines, aka Xanax or clonazepam, and anticholinergics like Benadryl. Recently, non-pharmacological interventions are being emphasized as more effective and safer. Some of these techniques are muscle relaxation techniques, listening to soothing music, aromatherapy, especially lavender, daily moderate activity, and the use of mindfulness or meditation apps. Melatonin is a naturally occurring hormone that can be supplemented to manage circadian sleep disorders. However, melatonin does have a risk of daytime sleepiness. Environmental modifications are the simplest and most effective in promoting sleep, and this can include things as simple as closing doors, adjusting lighting, and eliminating noise. Other health promotion strategies are listed in box 24.4, and these include tactics such as establishing bedtime rituals, avoiding alcohol and caffeine after 1 in the afternoon, and using relaxation methods. In older patients with dementia or depression, promoting sleep by being present and providing reassurance until they fall asleep is another easy intervention we can do as nurses. We also want to keep in mind that the relief of pain, anxiety, or other physical discomforts are the nursing responsibilities to help to promote sleep. Obstructive sleep apnea has serious health consequences that we've talked about already. The gold standard for obstructive sleep apnea treatment is continuous positive pressure airway pressure support. Continuous positive airway pressure, holy buckets, or a CPAP. We will just go with CPAP. So we want to teach individuals with obstructive sleep apnea the importance of complying with their CPAP use, or if we're in long-term care or acute care, we want to assist the resident or patient to adjust the mask, place it correctly, and use it every night when going to bed or even during daytime napping. Last question to kind of bring it all together. What is one of the most effective health promotion interventions to support healthy sleeping patterns for the older adult? The answer to this question is A. Health promotion interventions begin with educating the older client about age-related changes that will affect their sleep. Understanding age-related changes and sleep patterns can help alleviate the anxiety about their sleep problems or their change in sleep patterns. Encouraging bright lights during the day and moderate physical activity while awake may also help promote sleep. Although some herbal remedies are considered safe, like melatonin, non-pharmacologic interventions are usually more efficient and even more safe. Lastly, increasing caloric intake at dinner time will not promote sleep, and it might actually exacerbate gastric ulcer pain at bedtime and wake them up. Thank you.